We're at a very interesting point in the global pandemic. Very interesting. With the present variation, which clearly appears to be um, a lot more infectious, but the outcome is not as bad. In terms, people do not get as sick, people do not die as easily. A lot of people have been lulled into a false sense of security. I'm really concerned about this because the numbers are rising. The result of this is that, yes, we may actually back into a form of herd immunity, meaning that a lot more people having gotten the virus will now develop the antibodies, which will last for a while. But there's a downside to this. Huh? There are individuals who forget that the way by which you get the antibodies could have some consequences. For the last 30 odd years, I breed dogs, I show dogs, I train dogs. And then when you're dealing with thoroughbred dogs, you are concerned about every pup. So you make sure you fully vaccinate all of them. 4 sets of shots you have to give them. Now, people who grew up with mongrel dogs that had very little intrinsic value, they said, well, we never vaccinate our dogs at all, and the puppies and them live. But you forget how many died. You forget how many did not make it. But when you have puppies that you value, you vaccinate all of them to ensure the survival rate is higher. The result of what we're doing now, folks, is that some people won't make it. Because you don't know if you are going to be the one who the consequences of the virus would be much more dangerous for you. And the other things that a lot of people have forgotten, there's this thing called long COVID. We still don't understand the consequences and the nature of long COVID. That people who have been stricken by the virus, sometimes for months after, they have some extremely debilitating conditions. So my advice is to work through your anti-vax sentiments if you still have them. And you ask yourself, why are you doing this to yourself? Now, you go, look how many things you consume on a daily basis. And you have no idea what's in there. But yes, still you're questioning, you're concerned that there's something in the virus, there's something in the vaccination, even though that there is evidence, quantifiable, verifiable, empirical evidence of the testing and retesting. You were taking a serious chance. But the rest of you who are on the border, who are just needed a little nudge, this is my little nudge to you today. It's in your best interest. Follow the science. And the science is telling us clearly, before we thought 1 dose could do, now we realize no, 2. But then we realize that the booster is also important because it brings your level of protection up past the 90% mark. And what we're now having globally is a pandemic of the unvaccinated. If you wish to take your chances, I make sure that once I am outside of my bubble, I wear a mask. Now I'm on my morning walk. I walk in an area in the hills where there's absolutely, I don't pass anybody on the road. Occasionally you pass somebody on the other side of the road, you wave your hand. Occasionally a car goes by. But this is the environment in which I walk in the mornings. Fresh air. This is the second car that has passed me. I'm at my 2.5 kilometers mark. But I suggest to you that once you're out in the open air, you don't need a mask. But once you're around people that you can't vouch for, mask, social distance. As soon as I get back in the house or in the car, sanitize, because survival is important. We're going to get through this, folks. It's going to take a while. We're going to get through this. Have a wonderful day.